So first off, good morning, everybody, and welcome. Glad everybody could make it in to this year's conference. We're going to get started first with the introduction session, and then we'll get going from there. First things first. I'm Neil Dilworth, and this is Alex Mancella. Unfortunately, our third organizer, Mark Young, is not here for this morning. He'll be here later today, but we're the ones who put the conference together this year. I'm glad everybody could make it out, and we'd like to thank all the speakers for making the effort to come in. We've got speakers coming in from Alberta, Ottawa, and a number from Sick Kids as well. So there we go. So first off, the morning agenda. So we're going to start off with a talk from Dr. Person. Erica's coming all the way from University of Alberta, and she's going to give us a talk on sports specialization. Next after that, we're going to have a talk on spondylolysis and spondylolisthesis from Alex Mancella. And then we're going to have a talk from Dr. John Wong from Sick Kids on pediatric cardiac conditions in sports. Followed by a talk on the pediatric ACL by Dr. Duong Nguyen to round out the morning. For the afternoon, we have Dr. Jennifer Steinbeck from Sick Kids, one of our MSK radiologists, giving us a talk on MSK imaging, and Dr. Christian Goulet up from Ottawa to give us a talk on pediatric concussion. Then we'll do our University of Toronto Sports Medicine residents case and research rounds. We'll be able to present either their cases or the research that they're working on this year. And then we have a pediatric dental injuries talk by Dr. Ninba Bull, that's this afternoon, followed by some small group question and answer sessions. That gives you the opportunity in a small session to go up and in 15-minute breakout sessions to talk to Dr. Steinbeck about imaging, Dr. Babel about dental injuries, or any of the other colleagues around if you have any questions about certain cases, so it's a good opportunity to reach out at that point. The main goals of the conference are that we get to collaborate with our colleagues here from GTA and beyond and fill knowledge gaps. So we try and pick things each year where there are significant gaps in both care for our patients, but also from within a sports medicine field that need a little bit more attention or work, and that's what we try and bring these expert speakers in to help us with. We're going to explore some new inquiries, and then ideally we take this from today and we take this out to the community so it can enhance community care. A couple of housekeeping things. This is a small conference, so the main thing we want you guys to do is at the end, if you're leaving at like 2 o'clock or 3 o'clock, please just make sure you fill out the evaluations. This is what we use to essentially develop content and choose topics for the next year's event. The evaluation form is on the conference website. There's a link at the bottom, and I'll show that later. People are asking about payment. You can just send an e-transfer to my email. That's the Gmail email account. And upon receipt, we'll send out the CME conference certificate as well as the tax receipt. Okay, now we're going to talk about a few updates. Alan's going to talk about this is just some sports updates, medicine updates. Just got to keep an eye on.
All right, good morning, everyone. Just want to apologize for my voice to start. Decided to lean into my Sicilian roots and give my best Godfather impression. So, as most of us in this room are members of the GTA Sports Medicine WhatsApp group. It has about 64 members already, ranging in a variety of different specialties, from us as primary care sports medicine to physiatrists and orthopedic surgeons. It's been a really great resource, I think, for not only people that are early on in their careers, but from all of us at various stages in our careers, being able to ask questions and get rapid responses for a variety of difficult case rounds, looking for specific referrals, and even sharing sort of interesting things and interesting topics and pearls that we can all take forward with us in our practices. And then also importantly, asking for event coverage when we're all looking for new opportunities to grow our practices. And again, it keeps all of us engaged, and it seems like when we're seeing each other in this room, maybe once a year, thanks to Neil organizing everything, it feels that although we haven't seen each other in person, we feel connected by our rapid messaging in the group. So I think it's a really great resource, and hopefully we'll continue to expand as the years go on.
A couple other things. One of the things just to bring up, AI in sports medicine is something that we're continuing to work on. Obviously, this is something that is becoming very, very widespread. Can interact with everything from your clinical day, research, education, and the athletes that you're seeing, including the teams that they're working with. The widespread use does not equal competence, and one of the common themes starting to see, and this is one of the important things that I would just ask that you try and make part of your interaction with AI, is checking the accuracy of prompts when you're using things like generative AI, and then checking the accuracy of the output. The outputs that you get are very convincing. They're not always accurate. They can be if you give the accurate prompts. And I just think as physicians and healthcare providers in the community, this is something that we can do, just that one extra step to help ensure greater accuracy and safety for our patient population. The other thing to keep an eye out, Ira's going to come up and take a look at, we're keeping an eye out on our exoskeletons. This is a potential option for bracing in the future. What are the limitations? Ira, do you want to come up? I'm just going to show you a skeleton suit. So the main limitation with these at the moment, the prices come down, availability is there. The main limitation has to do with the fitting. So this is a hip exoskeleton. So essentially this will provide a increased force. So as, for example, if you're going upstairs, you want to just do some knee highs. That's providing force to essentially aid the hip flexion. Now, the problem with these is that this is only crossing one joint line, so the fixation points are mobile. So as your trunk is moving, your trunk diameter is changing, but it's only fixed to the one size like a belt would be. And same thing with your thighs. As your thighs are contracting and uncontracting, the size is changing. So at the moment, the fitting seems to be the biggest issue in terms of using these, but this is something that to keep an eye out. They have ones coming out for knees. There's upper body ones that can aid with shoulder that are non-battery operated. This particular model is battery operated, but it's something to keep an eye on and your patients might be asking for. At this point, I would say we're not ready to be using these, but just to keep an eye out for going forward. Now, we're very excited this year, so if we could lock the doors. We would like to present the University of Toronto Sports and Exercise Medicine Lifetime Teaching Award. And this is one of the things we did was we got Alex to go into generative AI to get a summary of our winner. You want to take a look at what's...
Yes, I figured what can AI teach us about this individual that we don't already know. So he is an associate professor in the Faculty of Kinesiology and Physical Education at the University of Toronto. He earned his medical degree at the University of Toronto in 1979, followed by his DIP Sports Med in 1989. His clinical and academic career, he served as the medical director at the UofT David McIntosh Sports Medicine Clinic from 1989 until 2021. He's been deeply involved with sports medicine for elite athletes, serving as a team physician for all of the UofT varsity teams for many years, Canada Women's National Basketball Team, National Beach Volleyball teams, and the Toronto Raptors from 1995 to 2004. His research and teaching focus include concussion in sport, biomechanics of injury, injury prevention, and promoting healthy, active lifestyles. And as ChatGPT told us, he is known for his engaging undergraduate course on healthy living and physical activity at UofT that challenges students to critically evaluate health claims and apply them to their real life choices.
So what do we say about Dr. Doug Richards? His unbridled enthusiasm for all things sports medicine, anatomy, physiology, and biomechanics has been an inspiration for decades for all of us that have the wonderful opportunity to engage with his teaching. Encourages learners towards understanding as opposed to just knowing things. His inspiration for us has been through further scientific inquiry and curiosity to further push the field of sports and exercise medicine. He's been an educational gem and a wonderful colleague. And we're just talking about AI. This is the real I. So to help us present this Lifetime Teaching Award, we've got our ALCS winning team physician, Dr. David Lawrence, Dr. Doug Richards, if you could please come up.
They're asking me to say a few words in a little while. I must say, at a time like this, no surprise that I'm actually at a loss for words to some extent. Doesn't happen too often. It's been deeply gratifying to be involved in this community for the last 40 years. And perhaps the most gratifying thing is to see the strong sport medicine community that exists in Toronto. I've had the pleasure of interacting with so many of you as you went through your training and so on, and to see the excellence and the leadership that's being provided. It's particularly humbling to receive a teaching award from the likes of these guys who are themselves so devoted to teaching and volunteer so much time and effort to fostering excellence in this community. So I'm deeply grateful and humbled. Thank you very much.